which direction you going. You gotta be careful. You gotta be careful, careful.
Where you go? Where you going? What you say?
Coming up towards 6:50 in Trinidad and Tobago, the merchant urging us all to be careful, and indeed in relation to COVID-19, especially with the numbers spiraling upwards over the last 3 weeks, we have every reason to be extra careful. And over the weekend, the Chief Medical Officer, Dr. Roshan, confirmed that Trinidad and Tobago is officially categorized as having community spread. This comes in the wake of a steady rise in COVID-19 cases over the past couple of weeks. We're joined now by two members of the Medical Association who have been our guests almost weekly within the last 2 or 3 weeks. The President of the Association, Dr. Darren Dookeram, and Professor of Anesthesia and Critical Care Medicine, that's Professor Dr. Hariharan Seetharaman, joining us as well this morning. Good morning, gentlemen. Thanks very much for joining us. If I could start with you, Dr. Dookeram, just explain to us, when we talk about community spread, Dr. Dookeram, what does that mean? And with the restrictions that are now being put in place, what extra precautions, as you understand it, we're required to take?
So first of all, thanks for having us back. The weekly session is very much appreciated on your show. We like being here, and thanks for having us. So I'm not an epidemiologist by trade. I'm an emergency medicine physician, but community spread really speaks to the process of contact tracing that they speak about when they do the releases. So they do epidemiological tracing to see where somebody would have been exposed to the virus. And therefore contracted it. So community spread is where there's that absence of a link. So you don't necessarily know where you would have contracted it. So it's in the community, and that's where you would have picked it up. So it could be anywhere. And what that translates into is you can encounter this virus, you can contract this virus in any scenario, whether it's the supermarket, whether it is just interacting in a crowd. But anywhere that you put yourself at risk, you have the potential to contract it. And therefore, to answer your question, it is to re-emphasize some of the things that we have spoken about on your show, in terms of maintaining social distance, in terms of mask wearing in public, in terms of hygiene with hands and hygiene with coughing. These are things that we cannot underscore enough. And given the unfortunate revelation over the weekend by Roshan Parashram, we really need to drive these points home, because we're obviously dropping the ball, and that's accelerating the spread. So my plea today on behalf of the Medical Association as a part of our advocacy program is to urge every member of the public to take responsibility for themselves and for their families, to protect themselves, and especially to protect the vulnerable people within their families and within their communities by following these very simple guidelines that we have spoken about before.
And before I bring Professor Seetharaman into the discussion, you talk about vulnerable. And at the very start of this COVID-19 thing early in the year, everyone was saying, well, it's only the senior citizens who are at risk. Yet, as we now hear, the 11th person who passed away, based on the Express reporting, was 45 years of age. We're hearing about children contracted COVID-19 as well. So what is your response, Dr. Dookeram, to those who might still hold the view that if you don't fall into that category of 65 and over, you might just get sick, or maybe it's just a bad flu, but you would recover from COVID-19?
Yeah, so, we speak about vulnerable groups when it comes to especially respiratory diseases. And Prof is actually expert in this part, but certainly people who are diabetic and so are higher risk of mortality in terms of having a negative effect and passing away. The transmissibility of this virus is high. We know that, and therefore it can affect any part of the population. But make no mistake, around the globe, it is not just the older people and the sicker people who are passing away. They may be at higher risk, but there's certainly a high degree of death all around in all populations.
And Professor Seetharaman, very good morning to you as well. And as in our last discussion, because we're learning more and more about the virus because it's virtually brand new, and I know there's all sorts of wild speculation as to where it came from. But from a scientific point of view, from an epidemiological point of view, we are understanding more and more about this virus as time goes by. What is your concern right now? If you have any specific concerns about our managing of the situation right now in Trinidad and Tobago, given that we now understand that we have community spread. Good morning to you once again.
Good morning. Fazeer, thank you again for having me in the program. And as you rightly pointed out, when it started in Wuhan, the statistics came and 5% of the people who contracted the virus went into critical care units. 5%, out of which 50% died. So 2.5% was the mortality when it came, when it first appeared in Wuhan. And we were discussing that this is an emerging infectious disease. The problem now is that we are now seeing so many different manifestations of this virus in all age groups. And just to make a point that people think that children are immune to this virus, which is not. And there have been lots and lots of cases with what we call as a Kawasaki type of syndrome. We have myocarditis, heart being affected, and there is intravascular clotting all over the body, and youngsters present with strokes. And there are so many different, the virus, this particular COVID disease is one of the masquerading diseases we have seen after syphilis and HIV. It affects almost every single organ system of the body. And my point again is that, we are still, not, very serious about it. And I will tell you that many of our colleagues even that, as you rightly pointed out, that this is just like a flu, people will get it and then, it will go away. And I know that there is a line between, we need to draw a line between fear-mongering versus taking it seriously. And I am not trying to raise any panic, but we must take this seriously because, as Darren said, the transmissibility, when, if it doesn't happen, but if I don't want that to happen, if 500,000 people contract the virus, 5% of that will be a big number to lose. Even if it is 2 to 5% is the mortality rate, and we are still struggling to exactly pinpoint the mortality because, as I told you, this is a textbook definition of emerging infectious disease. And all I want is, as Darren said, we need to take this very seriously and follow all the protocols. And also the government should, they are already, moving in that route. We know that, already there is some partial lockdown. But I will tell you, statutes and, things like law and all that can be there. But people who, people who follow the law and then they have to abide by, they have to take the personal responsibility. And, there is no point in having a statute, but nobody following it. So I think, we need to take this very, very seriously.
We're going to pause in a couple of minutes for the news at the top of the hour, and we'll continue our discussion with the two doctors. But Professor Seetharaman, before we get to that break, you talked about this virus appearing in different ways. Is it difficult to properly understand how this virus is manifesting itself? What I'm trying to say is essentially, are we satisfied that everyone who has passed away because of the complications of COVID-19 in Trinidad and Tobago has been recorded as such? Because it could be that someone died of heart failure or died of something else that would have been triggered by COVID-19. Is that a possibility?
There is the possibility, but they would have been otherwise reasonably controlled with the pharmacological management they had. But the COVID and the effect of the COVID and the cytokine storm actually aggravated their disease, which was not amenable to pharmacological management, and that can happen. But I wouldn't say that they would have otherwise died. they died only because of this, contracting the COVID virus, and that actually worsened their symptoms. Otherwise, they were okay. They were controlled well with their treatment. So, but we cannot exactly pinpoint that direct. They were absolutely fine before the COVID. I mean, there have been cases like that. We have had cases where absolutely they were no previous illness and no history of any disorder, but COVID actually they contracted COVID and then they died because of COVID. And I wouldn't say all the patients who died in Trinidad belong to that category, but because it has happened throughout the world, we must take that into account.
Indeed. Well, we've had 11 fatalities already. We're coming up towards 7 o'clock. We'll continue our dialogue with the two doctors, and especially to find out about masks and visors, because there are some people who wear visors and they feel that, okay, that might be good enough, or is it the all-encompassing mask itself, which is what we should be wearing? We'll find out that and some other bits of important information from our two doctors after the news, which is coming up right now here on Morning Edition. 6.5 minutes after 7 o'clock in Trinidad and Tobago, as we speak to our two doctors from the Medical Association, Dr. Darren Dookeram and Dr. Hariharan Seetharaman, in the context of the rising number of cases of COVID-19 in Trinidad and Tobago. We are now confirmed as having community spread. Fatalities have moved from 8, where it was for a number of months, to 11. We've had 3 fatalities over the past 72 hours, so it has become a very serious situation. It was already serious, but for those who would have taken it lightly, they would certainly now recognize that it is a cause of tremendous concern. And Dr. Dookeram, just the point of face masks as against shields, because for a long time, again, because information is changing and is being updated gradually. Many people would have felt that the face shields would have been okay, and now the urging, which is probably to become law very soon, that face masks are what are required. Just give us your perspective on that, please, Dr. Dookeram.
So I think to understand the concept of PPE and the implementation, we have to describe some of the modeling that Professor Harry would have alluded to earlier. When we looked at the initial numbers of COVID internationally, the numbers who were getting ill and the numbers who would have died without intervention. So if nobody had done anything at all, the numbers were exponentially more than what they would have been or what they were. And that model changed when certain things were implemented. And what I mean is by wearing a face mask, you decrease the transmission and therefore decrease the likelihood of contracting it and therefore decrease the likelihood of dying from it. And therefore the model changed with each intervention. So that's where this discussion comes from, because everything has to be based in science. And therefore, when we speak about masks, it's not that we just think it's going to work. Now, it's not an exact science, and nobody can say exactly at which point which mask is most effective, but certainly we have generalizable data which Prof will go into. Now, as we know, there are different types of masks. There are regular cloth masks, there are surgical masks, there are N95 masks, and like you said, there are visors, which are really face shields. Like Dr. Parashram mentioned in the conference, face shields really provide protection to the eyes and a certain amount of droplet spread because it is a barrier, but it certainly doesn't envelop the nose and the mouth, and therefore the mask would be superior. All of this is predicated upon something very simple, which is if you don't wear your mask properly, it's not going to give you the benefit that you seek. And I would have made the point on this show before that we have seen so many variations of mask wearing. It's incredible sometimes. And you often see people walking around with their mask underneath their nose. It must cover the nose. It must cover the mouth. It must go beneath the chin. And what goes along with that is proper use of it in terms of wearing it and taking it off. Because if there is virus on the surface of the mask and you touch the mask, you're going to get it on your hands and you're more likely to put it onto one of your mucosal membranes and contract the virus. So that's where PPE is. And perhaps Prof could just describe the other different types of PPE.
Please, Professor Seetharaman, I'm sure you have some more important information to add in relation to this level of face protection.
Yeah, there have been studies to see what type of masks prevent what size of particles getting inside. The surgical mask with a filter, which we all wear in our operating rooms, is almost equivalent to a N95, although it is not the exact like a N95. N95 is termed because 95% of the particles will be completely blocked from coming in. But I must say that wearing N95 is not easy. We don't advocate that everybody should be wearing N95 walking around in the community like that. So N95 is probably better for people who are frontliners, people who are actually facing these patients, probably infected with COVID, and confirmed COVID patients. We have a full hazmat suit which we wear actually to prevent any part of our body being exposed to the patient who had confirmed COVID infection. Even that is reserved to doctors and the other healthcare providers in a critical care unit, in the high dependency unit, in a hospital setting, and everybody don't need to wear that. I also saw some people wearing something very close to N95, but having a vent. And there was one study recently, 2-3 days back, it was published that people who are having a vented mask, it's absolutely no use at all, and they are contracting the virus. So there are many different variations, and I will say that when it came into the when the epidemic started, we ourselves said that we shouldn't be using masks at that time because we didn't have enough data. For the same reason, Darren said that we will be touching the mask, and then we will again touch our eyes or our nose or mouth, and that will actually facilitate the virus going inside our body. You must know that the virus it goes into the airway through the face, nose, and through the mucous membranes, and then reaches the lungs, and then there is the something called a angiotensin converting enzyme receptor, which is in the ACE inhibitor receptor. ACE receptor is in the lung, and it has a predilection to get into that particular receptor, and then gets into the body. So face mask, which is tight, is important. For for a community, yes, cloth masks are enough, but I wouldn't say that it's 100% protective. For people who are in the hospital, they must wear N95 or at least surgical mask, which can filter the virus. And for people who are working in the COVID hospitals or the quarantine centers, when they know that the patient is definitely infected, they must have much higher forms of the personal protective equipment.
Dr. Dookeram, I don't know if you're a beach lime fellow or river lime kind of person and so on. Dr. Dookeram, would people have put themselves at serious risk with the rush to the beaches and the rivers yesterday?
I must say I only attend those things when the West Indies are taking the field, Fazeer. So I think what was urged at the press conference over the weekend was for sensibility, so that people wouldn't go and gather in large crowds and expose themselves. It goes back to the social distancing, and again, it's based in science. So the likelihood of a droplet containing viral particles spreading beyond a certain point, and again, this is not exact, but that's why they speak about the 6 feet. And if you think about some of the images from the beaches, a lot of people are not 6 feet apart, so they are inherently putting themselves at unnecessary risk, and that in itself is something that we've been trying to work against. And just again to reemphasize something that Professor said, certain masks for certain instances. So we don't want to have a situation where a lot of the PPE is being wasted or inappropriately used. Wasted is a strong word. And then when the cases really escalate and there's a significant need for it in the health system, it's not available, because then we are putting our healthcare professionals at risk. And that is something that we cannot have, because if you look at the data internationally, healthcare providers, the healthcare workers are part of that group at high risk, because we're in constant contact with people who come in with respiratory diseases. And certainly a lot of the equipment needs to be reserved for frontline staff.
And Dr. Dookeram, and I know it can be a sensitive issue when you're talking about the behavior of the general public, but you can probably guide me based on your own observation of things as to whether or not people are really stepping up as to their level of awareness. Because just looking at the Express editorial today, for example, it says a time for strict enforcement, and it says in its second paragraph, the fact that educated adults are on social media championing the case for churches, and you could say, well, mosques and mandirs and so on, and bars to remain open at a time when people are dying from COVID-19, demonstrates just how difficult the communication challenge is. So Dr. Dookeram, in that sense, are people getting the message? Are people more inclined now to wear their masks, to maintain the physical distancing, to avoid crowds? Are you seeing that happening at all?
So what I would say is that this is not a problem that is unique to Trinidad and Tobago. And I think a lot of it has been kicked around in the media, especially in the United States, because of their peculiar political situation.
That is a polite way of putting it.
So when you have these alternate views on things that should and should not be done, it's always going to create some degree of uncertainty in the public. I can tell you my experience on election morning, just to again mention it. There was one person in the line who was not wearing a mask, and the crowd around him went beyond 6 feet. So he had a circle around him of about 15 to 20 feet, just people trying to avoid him. So I think by and large, our population is educated, and our population will listen given the encouragement. I do think that sometimes we need to push that conversation a bit, which is why we try to make the time to sit and have these conversations with the media. And I do believe, or I do support that view from the Prime Minister, where certain things do need to be made mandatory, to remind people to wear their mask and to practice proper things when they go out in public, like not crowding into spaces. To speak specifically to your point, I have no issue with partial closures like are happening now. I think it's essential, and if you look at what's happened in Europe, administratively, they've not had a choice. They tried to reopen as much as possible for economic reasons, and that's fine, that's understandable. But they've had to roll back on a lot of the things that they have tried to reopen. And in an attempt to prevent our healthcare model from collapsing, we really need to take these things into consideration and have some understanding for the epidemiologists and so in the Ministry of Health, who are really doing a good job. My shout out to Avery and Narration today, really good people and very trustworthy people.
And a final perspective from Professor Seetharaman as well, and we were discussing off air that the numbers keep rising. In fact, just yesterday, the former Indian opening batsman Chetan Chauhan, a long-time opening partner with Sunil Gavaskar, passed away from COVID-19 at the age of 73, and the numbers keep rising. Professor, what is your final bit of advice to the people of Trinidad and Tobago this morning?
I'm telling you, I mean, I am getting data from my own medical school. You know, in my province of Tamil Nadu, so far 47 doctors have died just because of COVID, which is a very big number. Many of my juniors and many of my classmates, husbands and all, they have died. And it is not, I'm not fear mongering. It is a very serious disease. Please. You know, I do understand the freedom of practicing religion, you know, freedom of congregation, but, you know, the social responsibility, when it takes, I remember, you know, I think it's Bernard Shaw who said that, you know, when a lady was, you know, swirling the umbrella and going, yes, but you have the freedom to swirl your umbrella, but the freedom stops with the tip of the umbrella. If the tip of the umbrella is hitting me, your freedom is lost. So people have to understand that if they don't have the social responsibility, it is affecting others. It is not only affecting them. So, you know, this is a personal responsibility transferred to a social responsibility. I think, you know, people have to take this seriously, and there is no second thought about it.
Professor and Dr. Darren Dookeram, thank you very much for taking the time to be with us once again. And indeed, it's so very important that we continue to get these updates from our medical professionals in an environment, especially on social media, with dangerous dotishness being perpetuated by people who should really know better. And that's why we urge you, myself, all of us, to really listen to the recognized and respected authorities for information, because COVID-19, if we haven't realized it as yet, it ain't no joke, and it is now fully fledged on our shores, and we are now grappling with the challenges as a result of that. 7:21, as we go to the break, a couple of submissions by Marie of Lal to Trace in Pinal. This floral image is called Call, Dump and Kiss. Interesting one.